So here's our patient today. She is a 62-year-old woman who does not like the excess skin and puffiness of her upper eyelids and the puffiness of her lower eyelids. And you can see it from the side. So today we're going to be performing an upper and lower blepharoplasty to remove the excess skin and a little bit of fat from the upper eyelids and the excess fat and a little bit of skin from the lower eyelids. Let's head to the OR and I'll show you her markings. Alright, here are her markings in the OR. And you can see we'll be removing a good amount of skin from each upper eyelid. Also just a little bit of fat from the medial and the central fat compartments of the upper eyelid. There are 3 fat compartments in the lower eyelid that I'm going to remove by making an incision on the inside of the eyelid and then make a little incision on the outside to remove a pinch of extra skin. So I'll show you how she looks afterwards. It's going to look a little scary, but in the end she's going to look great. All done. She did really well. So I removed the extra skin from each upper eyelid with a little bit of puffy fat from those 2 compartments. Removed a good amount of fat from her 3 lower eyelid compartments and a pinch of extra skin that's going to give a little scar underneath the eyelashes. That should heal real nicely. And I look forward to showing you how she looks here in just a few weeks to a few months. This is the fat that we took from her lower eyelids. You can see there's 3 fat compartments in each lower eyelid, and I did end up removing a symmetric amount from each one, so look forward to showing you how she looks. Okay, we're here with our patient, and she is 6 weeks out, and you can see she's healing really well. Still a little bit of swelling, and things are going to continue to improve. I'm going to have you look straight ahead as I show you from the side here. So the puffiness is gone from the lower eyes. The upper eyes are opened up. If you can close for a sec. Good. She has a little scars in the upper eyelids. Those are healing so well. You can go ahead and open. And she is just going to continue to improve as the swelling comes down over the next several months. You feeling all right?
Yeah, I feel great. Thank you. It looks amazing.
Good. Thank you. She looked pretty good, right? I hope you enjoyed watching that. So I've got a couple of quick tips if you're thinking about having either an upper or a lower blepharoplasty that I'd like to share with you before we finish this video. The first thing is if you're going to get your upper eyelids done, and especially if you've got a lot of skin, if you've got so much extra skin of your upper eyelids that you actually have problems seeing, like you have problems seeing traffic lights above, then your health insurance may actually cover that surgery. What you want to do is get evaluated by either an optometrist or an ophthalmologist to see whether you have what we call visual field deficits, where you literally can't see up high because that extra skin is in the way. If that's the case with you, then you may get your health insurance to help cover that cost. Second thing to think about is if you're thinking about lower blepharoplasty, your lower eyelids, there are 2 techniques that I recommend. There's the pinch technique, which I did on the patient that you saw here, where not only do we remove extra fat, but we remove a pinch of extra skin, leaving a little scar right underneath the eyelashes. The other option is the scarless technique. For people who are younger and they've got puffiness but they've got good skin, a lot of men I do the scarless technique. That technique, basically all we do is remove fat from the inside of the eyelid. The incision, the scar, is actually on the inside of the eyelid, so you can't see it afterwards. So it's a surgery where if it's done well and on the right person, there'll be absolutely no visible signs of that operation. So if you can, look at the scarless approach for your lower blepharoplasty. Otherwise, the pinch is what I recommend. There's a traditional technique where it looks kind of like a pinch, where you make an incision underneath the eyelid and then you cut through the muscle in order to get the fat out. That's the traditional blepharoplasty. I discourage that, okay? Higher risk of complications, and the main thing we worry about with this surgery is the eyelid pulling down afterwards. Nobody wants that. So stick with the scarless or the pinch, and you know that you're going to be getting a safer result. Finally, super important, after surgery, you gotta take it easy. One of actually the most feared complication from eyelid surgery, any eyelid surgery, is you can actually go blind afterwards. It is obviously very rare, but it can happen. And the way it happens is if you get bleeding, and the bleeding actually occurs behind your eyeball, that can increase the pressure around the little blood vessels that supply your eyeball, and people have actually gone blind from it. And that can happen after an upper or a lower blepharoplasty. So listen to your doctor, really take it easy, keep your head elevated after surgery, and you're going to limit that risk of bleeding that can become potentially tragic. So Hope this has been helpful for you. We've got some more great information. Just click the video on the screen down below, and we'll see you in a minute.